Howdy, my name is Ryan Butler, and this is my head to toe assessment interview, and this is my patient BB. BB, can you tell us how old you are?
I'm 26.
Okay, and what brings you in to see me today?
I have some hip pain.
Okay, and when did this hip pain begin?
It began probably a couple months ago when I was running.
Okay, and which hip is it in? Is it in both hips, or your right hip or left
My
hip?
right hip.
Okay, and can you describe how long the pain lasts?
It lasts, I'll go run, and then it starts when I run, and then it'll continue for a couple hours afterwards.
Okay, and can you describe the character of it? Is it sharp, dull, constant?
It's a dull type pain.
Okay, does anything make it worse?
No, it starts when I exercise.
Okay, does anything help it feel better?
I take ibuprofen when it starts to hurt, so that seems to help.
Okay,
some.
good. And how about how often does this pain come on? Does it come on just whenever you run?
Yeah, it seems like whenever I start running.
Okay. And on a scale of 1 to 10, with 10 being the worst pain, what would you rate it at?
I would say probably a 6.
Okay.
6 or 7.
Okay. Well, let's talk a little bit about your past medical history. Can you describe that for me?
Well, I have cystic fibrosis and asthma.
Okay. And when were you diagnosed with cystic fibrosis?
When I was 2.
Okay.
Mm-hmm.
Same with the asthma?
Mm-hmm.
Okay. Can you tell me about any surgeries that you've had in the past?
I've had a gastrostomy placement when I was 2. And then when I was 8, I had a port placed. And when I was 10, I had it taken out due to infection. And then I've also had about 5 sinus surgeries to clean my sinuses out.
Okay. How about allergies? Are you allergic to anything?
I'm allergic to penicillin and vancomycin and Levaquin.
Okay. And what kind of reactions do you have with those medications?
Penicillin and vancomycin, I swell up usually, and then the Levaquin, I have joint pain.
Okay. How about your medications? What medications are you currently taking?
Most of my medications are breathing treatments. I take Zopadex and hypertonic saline and Pulmozyme twice a day. And then I also do a vest airway clearance twice a day. And I also recently started a medicine called Orkambi, and then my vitamins. And then I also use a inhaler when I exercise or anything like that.
Okay. What about your family history? Is your parents still alive? Do you have any siblings?
My parents are both still alive. My mom's in good health, and my dad has hypertension and high cholesterol. My sister's in good health. She's married and has 2 kids.
Okay. What about your occupation? What kind of work do you do?
I'm a librarian at an elementary school.
Okay. And what was your previous occupation before that?
I worked at a public library.
Okay.
Same environment.
Okay. Any hazards that would be involved with the workplace that you know of?
No.
Okay. Do you smoke?
Mm-mm.
Do you drink?
No.
Have you ever done any illicit drugs like marijuana or heroin?
No.
Anything of that nature? Okay. What about your immunizations? Are you currently up to date on your immunizations?
Yeah, as far as I know.
Okay. What was your most recent vaccine that you've had?
I had a flu shot back in October.
Okay. Tell me a little bit about your diet. Are there any restrictions with your diet? Or
No. I try to eat fairly healthy. I try not to eat a lot of sweets and fruits and veggies and protein.
Okay. And what about your exercise? How is your exercise? Are you limited on anything?
Not really. I still get out and run even though I have hip pain. And then I try to do that like 3 times a week. And then I lift weights, and if the weather's bad, I'll do workout videos or something like that.
Okay. And how far do you try to run?
Usually 2 to 3 miles.
Okay. What about your sleep pattern? Are you having any sleep issues that you know of?
No.
Okay. And how, are there any other health concerns that we need to discuss today?
Not that I can think of, no.
Okay. And that concludes this video.